welcome. We are doing a doc talk today on constipation. We're going to be just looking at some different approaches to this super common symptom that people come in all the time with. So I'm Dr. Anastasia Stocker, and I'm here with Dr. Mary Schroeder, who I'm really excited to be here with. We did another doc talk a few weeks ago. If you missed that, that should be available on the website to take a look at. It was looking at rhythm and flow and talking about hormones, and that was a really interesting talk we did. Dr. Schroeder is a naturopathic doctor and a licensed acupuncturist. She just recently joined ARIA, and she's really focusing on women's health, gastrointestinal health. She's doing pelvic floor therapy, which is super awesome to be offering. And yeah, I am the resident here at ARIA. I'm working under Dr. Ginny Bennett, which I think a lot of you know, focusing on autoimmune disease and gastrointestinal health. I also am an acupuncturist, so I bring that to my patients as well, as is Dr. Schroeder. And yeah, we're really glad that you can be here today. Okay, so some things that we're going to cover today are just what is constipation. There's different types of constipation that a lot of people don't know about, going over some common causes and less common causes of constipation. We're going to talk about the foundations of a healthy bowel movement and a little bit about the physiology of bowel movements. And then we're going to go through some different treatment ideas. And if anyone has any questions, you can definitely either type them into the chat or unmute yourself, and we'll be happy to answer questions as we go along.
All right, so what is constipation? So constipation is defined as fewer than 3 bowel movements per week and or stools that are hard, lumpy, dry, or difficult to pass, and or feeling that not all the stool has passed. So this is just basically explaining that often when we think about constipation, we're often thinking about frequency of bowel movements. So, if you're skipping days or if you're skipping 2 days, but it also includes the consistency and sensation of defecation. So, and even the sensation of feeling incomplete is part of constipation. So it's kind of a broader category than many folks consider it to be. So there's a number of different types of constipation. One is atonic constipation and 2 is spasmodic constipation. So atonic is the most common cause of constipation. It's caused by poor or no motility as the root cause, and it generally doesn't cause pain. So in this case, the muscles that line your digestive system are not functioning properly. They may be too lax or not coordinating correctly. And it's not that your muscles are kind of spasming or clenching, it's just that they're not moving things through. And therefore, you're not having that sensation of your bowels clenching on something. So that is why it doesn't cause pain. Versus spasmodic constipation, with this condition, we see an increased muscle tone interfering with the passage of stool. So you can imagine, and we'll go through the anatomy a little bit more in a couple of slides here, but there's all this circular muscle that surrounds the small and large intestine, and that is contracting in a hopefully coordinated way. And sometimes when you're not having that coordination or there's too much contraction, the over contraction that's actually contracting on fecal matter can cause a lot of pain. So that sensation of cramping and pain in your lower, it's most often in your lower left abdomen, is the pain we're talking about here. And this type of spasmodic constipation is always associated with pain before or after a bowel movement. So next I'm going to show you the Bristol stool chart. This is a really useful tool that we use with most patients when we're talking about digestive issues. And it allows us to communicate about stool, because it can be hard to describe, and it's nice to just kind of see it visually. And interestingly, there's so many different types of stool. So the ideal is that type 4, which is kind of a long formed banana shape that's easy to pass. And then we have all variations between small hard lumps and liquid diarrhea. And each of these stool types indicates something very different going on with your physiology. So if we ask you about stool, don't be alarmed. We talk about it all the time. It's one of our favorite subjects, and you don't have to be bashful about it.
Okay, so we're gonna just go into some of the causes of constipation. Constipation can really be challenging to identify the root cause of this. There's so much that comes into play into having a healthy bowel movement. Some of the most common ones, of course, are dietary, how much you're eating, drinking, what you're eating and drinking, food sensitivities, those delayed type immune reactions that you can have to food can change how your microbiome interacts with the food and causing changes to the stool. Also, any true type allergies, or what we call those quick onset allergies, can cause some changes to the stool also. And like I said, microbiome changes, we're often thinking of those methane producing bacteria, or archaea, we should say, causing a decrease in transit time, which leads to constipation. There's also IBS and other functional roots of digestive issues. So with IBS, you can have a range of constipation to diarrhea or a mixed type, and we often see that. There's also structural issues. We'll go into the position that you should be in when you have a bowel movement. There's also things like pelvic floor dysfunction and those muscles, and especially in that hammock of muscles that allow stool to be passed out as you're having a bowel movement, can just become disordered a little bit, and what we call an outlet dysfunction. There's also hormonal changes. So our GI tract is really influenced by hormones. We need to be in a rest and digest frame of hormonal influence to be able to have healthy bowel movements. So anything that is affecting your thyroid, and your thyroid being a little bit sluggish, or your parathyroid, which are the glands that sit right behind your thyroid, being overactive, can cause changes to your digestion. Also, there's a big influence with female sex hormones, so the estrogen and progesterone, causing changes to your digestion, which I think is really common. We talked about this in our last talk about how at different times in the menstrual cycle, a lot of women can experience changes to their digestion. And then, of course, anything that we put into our body, including medications, can change how we poop. So a lot of things that cause constipation are those opioids, any psychiatric medicines, so like antidepressants and things like that, antispasmodics, and things that we would use for like overactive bladder. Antacids, really common. So if we're having kind of dysfunction in the upper GI tract, it often leads to a little bit of dysfunction lower down. NSAIDs, so ibuprofen and things like that, can change our digestion. Bile acid sequestrants, and these are often used for high cholesterol, so things like cholestyramine. And then the diuretics, the things that are gonna, things like Lasix, or things that increase urination, will just tend to dehydrate you and cause more constipation. And then the not so common causes of constipation, but things that are always on our radar, we want to just make sure we're not missing any sort of cancers or neurological disorders. So things like ovarian cancer, if you've been working on your digestion for a long time, but you're just having vague abdominal discomfort and persistent bloating that is just not responding to any sort of treatment, then we need to investigate a little bit more, make sure there's no ovarian cancer. And people that have family history of any breast, ovarian, or prostate cancers, any of those kind of glandular cancers, make us a little bit more concerned. Then, of course, colon cancer, it is a lot more common than we like to believe. They just recently lowered the age for people to get colonoscopy screenings for colorectal cancer. So that's really important to point out. It used to be 50 and now it's down to 45. So if you're 45 and you have average risk, it's time to, get in for that colonoscopy, or at least doing some other testing to make sure there's no blood in your stool. And symptoms of colorectal cancer can be abdominal pain, cramping, changes to your bowel habits. So change in the size of your bowel movements. If they used to be kind of larger and they're now more pencil or thin, that's definitely something you should bring up to your doctor. If you see any blood or mucus in your stool, just get checked out. And then, of course, there's the neurological disorders, and that leads to damage in the nerves in the colon and the rectum that tell your body to contract and have a bowel movement. And we can see that in things like MS and Parkinson's, and then autonomic neuropathy. And that's often seen in people that have diabetes for a long time, and the high levels of sugar can kind of damage the nerves. And so we can see kind of nerve issues all over. And then, of course, stroke, or if you have any sort of spinal cord injury, it just affects the nerves depending on the level of where that has been affected. And then things like gastroparesis, that again is an issue with the nerves and the timing of the transit of the stool through your intestines. And we often see gastroparesis go hand in hand with diabetes is the most common cause, but it can be caused by other things too. All right, so what we're gonna just focus on today, the nitty gritty of it, is the foundations, nutrition, movement. We'll talk about some herbal medicine and our favorite things that we like to use with people that have constipation. We'll talk a little bit about physical medicine. That's really something both Dr. Schroeder and I are passionate about. We love using physical medicine, mind-body medicine, some supplements, and then we'll just do a quick highlight of some different pharmaceuticals that we kind of leave if we can't use the other things, but it's good to talk about.
Okay, so next I'm going to describe normal digestive function. Our digestive system is an incredibly complex, beautifully coordinated system, and so it's kind of a miracle when we are able to actually digest things properly. And so first we want to understand what's working when it's going well, and then that kind of helps us understand what is not working when we're having constipation, bloating, all these kind of digestive symptoms. So normal digestive function starts with smell and taste. So and also to some extent visual cues. So it's really important to slow down before a meal and allow yourself to smell your food. It's a great way to, if you're cooking beforehand, and just kind of taking a moment to smell all of the spices you're cooking with. And then there's taste. So particularly the bitter taste can really help get our digestive system prepped. So one of the tools that we'll talk about later are digestive bitters. That bitter taste will stimulate the vagus nerve, which is the main nerve that innervates our digestive system, and kind of get everything starting to go. So this coordination starts in the mouth. So you start to secrete salivary enzymes into your mouth. That sensation of salivating when you smell something good, or when you think about food, or when you're hungry, that's all because of this sort of prep work that your body is doing. So you start to break down starches with an enzyme called amylase in your mouth. And then it goes, the food bolus will start to go through your esophagus, down into your stomach, and then through your small intestine, and then through your large intestine, and then through your rectum. And in each of those stages, there's an incredible coordination that's happening in that smooth muscle that involuntary muscle that's surrounding the digestive system. So your stomach, even though you don't necessarily know this is happening, it's contracting in an incredible amount when your food is being digested. This process requires coordination from what we call the enteric nervous system. And that nervous system is one of the biggest parts of our nervous systems. It's what we call the second brain that exists in our gut, and it coordinates the muscle contraction through your entire digestive system to allow that bolus of food to get through. Now, if there's any lack of coordination in that system, as kind of we were mentioning before, you may have too little contraction and have the atonic constipation, or you may have too much contraction and have the spasmodic constipation. So throughout this process, digestive secretions are coming in at different times, and that is also coordinated as the food goes through. So again, we have the salivary amylase starts to break down starch in the mouth, and then it comes down to our stomach where we secrete hydrochloric acid, and that starts to break down proteins. And then it goes into the small intestine, and at that point, the gallbladder will actually contract in coordination with the food bolus and secrete bile into the small intestine, and that helps emulsify fats, kind of like soap helps emulsify, like, the oils on your dishes. That's kind of how bile works. And then at the same time, pancreatic enzymes are secreted into the small intestine, and those help further break down sugars, fats, and starches. Then we get down to the large intestine, and that's where the majority of our beneficial microbes live. And it's there that we further break down fibers to form short-chain fatty acids through our microbiome, in addition to many other byproducts. So our microbiome is constantly working for us and producing B12, neurotransmitters, and many other things that help our physiological function. And then the last part of it that we'll focus on today is the coordination of defecation. So that's when you go to have a bowel movement, you need a contraction of your abdominal muscles. And then there's this intricate coordination within your rectum and the surrounding pelvic floor muscles that's the hammock of muscles that exists below your pelvic organs. And when you start to feel stool in your rectum, that stimulates the relaxation of your anal sphincter, as well as the relaxation of your pelvic floor muscles. And this is an important piece because when those are too contracted and not relaxing, that's one of our major causes of constipation that we'll see out there. So we'll discuss more on that and how to treat it in future slides. Okay, so next we're going to run through the foundations to a healthy bowel movement. So when you're thinking about promoting healthy bowel movements, you want to think about the 4 F's. So that's fiber, fluids, fitness, and flora. So we want a fiber intake of about 25 to 30 grams per day. So this is, we can largely get this through food, and if we can't get it through food, we can supplement with different types of fiber with our meals. We want to get adequate hydration. So that means aiming for 1/3 to 1/2 of your body weight in ounces of water. So for instance, if you weigh 140 pounds, you want to drink 70 ounces of water a day. Most patients, when I tell them this and tell them the number, they're kind of floored and they're like, I'm drinking like 15 ounces of water a day. It's a lot of water, and it's helpful to have a water bottle that has a known amount in it so you can keep up with hydration. Regular daily movement is key to promoting bowel movements. So the mechanical motion of our bodies and our muscles as we're walking around actually is good for us in many different ways. And one of the ways it helps is by actually physically moving stool and helping the sort of mechanical motion of the stool through our digestive tract. And then lastly, we really want to focus on healthy and diverse microbiome. So if you have had any exposure to antibiotics, if that's kind of the main insult in our culture with the microbiome, you really want to focus on probiotics, on supporting your microbiome with a number of dietary tools. So that's mainly going to be a variety of fibers and also giving them a wide variety of micronutrients. So, eating the rainbow is helpful for us and also our microbiome. And we'll discuss more on that in a few slides as well. Okay, so the next foundation to a healthy bowel movement that you can just practice on a daily basis is your position when you're on the toilet. So in our culture, we all sit on toilets in a 90-degree angle. And, ironically, this is actually one of the worst positions for having a bowel movement. And that's because of the orientation of the rectum. So as you can see down here, our rectum when we're sitting is actually kinked, and it takes more pressure to get the stool out of our rectum. And we also have a muscle called the puborectalis muscle that wraps around our rectum here. And, it prevents us from having bowel movements. It allows for better bowel control. But that's one of the muscles that needs to coordinate to relax to allow us to then have a bowel movement. So when we're in that sitting position, that kink is happening. However, when we're squatting, that allows for a straighter rectum and promotes the relaxation of that puborectalis muscle. It also helps with the relaxation of other muscles in the pelvic floor. So there's a larger muscle group called levator ani that's in that hammock that I was discussing before. And the rectum goes through all of those muscles. So if you have any pelvic floor tightness, that is another thing that can get in the way of the stool exiting. And so these two muscle groups need to coordinate with the anal sphincter to allow stool to exit the rectum. And there are some syndromes where it's called a paradoxical reflex, where it actually, when you go to have a bowel movement, those muscles actually tighten. So that's one of the things that we can talk about addressing with physical medicine later on. But in order to enable a healthy bowel movement, one of the first things you want to do is consider getting a squatty potty. So that's it's like an extra piece that you can put underneath your toilet to bring your legs up so that you're in more of a squatting position. And if you're really adventurous, you can actually sit, squat on the toilet bowl, but that's challenging. And then leaning forward is another one. If you don't have a squatty potty, just leaning forward rather than sitting up straight.
Okay, so we're going to talk a lot about fiber. Dr. Schroeder mentioned it. It's really important for both our microbiome and to help push the bulk of stool through our digestive system. So when we think about fiber, there's two types of fiber that we focus on. There's soluble fiber, there's insoluble fiber. And what this means is the ability of the food materials, the fiber, to dissolve in water, right? So soluble fibers are ones when you put it in water and you mix it up, it's going to completely dissolve. You're not going to notice anything in there. It might make this like kind of jelly substance when you mix it in. And then there's the insoluble fibers, and that's the things that are a little bit tougher, harder to digest. And that's what's really going to help bind other things and push things through your digestive system. So we want a nice balance between the two types of fiber. The soluble fibers, when they're coming from mainly fruits and vegetables, and those different colors of fruits and vegetables, are generally going to be a little bit better at preventing constipation when compared to the whole grains. The whole grains have lots and lots of the insoluble fiber, which is important too, but we do like to get the bulk of our fibers from those fruits and vegetables. They can just help push things through, kind of lubricate the intestines to help move the stool through. And there's a lot of information on this slide, so I'll let you guys come back to it as you need, but that's just the basics on fiber. Okay, so some good sources of fiber. So prunes, everyone kind of knows that old adage that prunes make you poop, and it's true. And it's because they're a really good mix of both types of fiber. They're really 50% soluble and 50% insoluble fiber. So how we like to use them is, use a couple every day, a couple of dried prunes. We want to rehydrate them or cook them. So you can kind of stew them, or you can just put them in some water and then put them into whatever you're eating. It's really good to put them in like oatmeals and things like that have other sources of fiber. Flax seeds, so aiming for 2 tablespoons of ground flax seeds per day. And flax seeds also contain a lot of omega-3 fatty acids. And because of that reason, we generally like to tell people to ground the flax seeds the day that you're going to use them. Otherwise, they tend to go rancid, and that's not that pleasant. So you want to use fresh flax seeds, or if you do grind them ahead of time, you can store them in your freezer. That's what I personally do. I'll grind a little cup of them or something and put them in my freezer, and then just add them to things as I need, and adding them to just like whatever you want, smoothies, oatmeal, yogurt. You can sprinkle it on top of salads, just really any way to increase that fiber intake. Chia seeds, those are really great too. You can make some chia seed pudding just by soaking chia seeds overnight, adding them to whatever kind of milk that you like, a little bit of sweetener. And then the chia seeds, they're full of that insoluble fiber that kind of becomes gelatinous. So when it mixes with that milk, it kind of gets really thick and creates a pudding-like effect. I also like to, you can do that, and you can also blend the chia seed so it becomes like this chia seed powder. And when it mixes with the milk, you don't get the chunks of chia seeds that sometimes people don't like. And then just always just aiming to cover your plate of food half in vegetables. It's just an easy way to think about, am I getting enough fiber in every meal? Of just putting at least half of your plate with those fibrous vegetables, the leafy greens, the things that aren't really starchy. So any of the vegetables that aren't like potatoes, corn, and things like that. But those leafy greens and all those good vegetables. Okay, this is a slide that I like to use, and I give it as a handout to a lot of patients. I'm not going to go through this in any detail, but feel free to like screenshot it. This video recording will be available on the website too, so you can always watch it again, fast forward to this point, take a screenshot, or use your phone camera to take a picture. It's just a good idea because we're aiming for that 25 to 30 grams of fiber, and that's hard to quantify when you're first thinking about fiber. The average American intake is about 10 grams of fiber. So we're often asking people to kind of double or triple their fiber intake, which can be kind of difficult. So it's kind of good to just get an idea of what you're eating, and just to start tallying it up, doing it a few days, and then pretty soon you'll just be a pro at it and not even have to think about how much fiber you're getting anymore.
All right. So another way to support our bowel movements through nutrition is by getting fermented foods in our diet. So fermented foods can give us a probiotic effect, particularly the ones that are unpasteurized. So we think about the sauerkraut, kimchi. Those are fermented cabbage products. And those are really great. I like to kind of have them around in my fridge. And I'll often add a couple of tablespoons with each meal so that I know I'm just getting some probiotics on a regular basis that taste good. I also, if you can handle dairy, kefir and yogurt are great sources of probiotics, particularly lactobacillus. And there's now lots of yogurt alternatives that are not dairy based, not cow dairy based. So there's oat milk, and there's cashew yogurt, coconut yogurt. So lots of options there. And then we have kombucha as another source of probiotic that is tasty and can add to our day. So another thing that we touched on before is movement. So again, it provides that mechanical help to move stool through our digestive tract, and it also helps us regulate our autonomic nervous system. So you may be familiar with the term parasympathetic and sympathetic autonomic nervous systems, and those are two sort of different phases that we can get into, and when we're eating, the main thing we want to aim for is the parasympathetic state. And exercise helps us kind of flush out our catecholamines, and that's our adrenaline and our cortisol, our stress hormones, and helps us relax by the end of the day, and at various points in our day, to then sit down and focus on eating and digesting. So generally we want to aim for aerobic exercise for around 40 minutes a day. And then there's specific poses that we can do if you're struggling with constipation, to promote a bowel movement. One of them is called wind releasing pose, where you pull your both knees up to your chest while lying on the floor, and you can start by pulling your right knee over to the side and kind of up into your armpit, and that's going to kind of help massage your ascending colon. So that's, if you're looking at your abdomen, starting on the right hand side, your ascending colon comes up, and then you go across and then down. So the position there is going to help massage your ascending colon with your right leg, and then you can kind of pull both legs together and rock a little bit to massage your middle colon, and then with your left leg you can pull it into your armpit and help massage your descending colon. Another thing to think about in that vein is self-abdominal massage. So in addition to getting visceral massage that Dr. Stocker will talk about in a moment, you can at home work to massage your colon by starting in your lower right hand side, kind of coming up along the side of your abdomen, up along the bottom border of your rib cage, so from right to left, and then down the left hand side. And you can use castor oil and some sort of sesame oil with a mint or some kind of aromatic oil added. And that's a really nice daily routine to have when you're struggling with constipation. All right, so next we have herbs. We love to use herbs here. And we love to use herbs in different ways depending on what someone's coming in with. So we have bitters as one of our main categories. We can use this in a couple of different ways. So one is to use it with drop dosing before a meal. So you've probably heard of digestive bitters, kind of aperitifs and pre-meal bitters, and you can use those under your tongue half hour before meals, and that is going to stimulate the vagus nerve and get your peristalsis and digestive secretions starting. So we've seen that the intake of the digestive bitters will actually increase hydrochloric acid production in the stomach prior to a meal. So some of these herbs that are bitter in nature are going to be dandelion, artichoke, and then ginger is one of our more warming bitters. Our next category we have is demulcents. So these generally need to be extracted in cold water. If they're an herb like cinnamon, you can take a whole cinnamon stick and leave it in cold water overnight, and overnight it's going to get that mucilaginous feel. Then we also have marshmallow root, aloe gel, and plantain leaf. These are all great for soothing our digestive tract. So if we have gastritis, which is an inflammation of the stomach lining, if we've got GERD, which is the acid reflux kind of irritating our esophagus, if we've got food sensitivities and inflammation in our digestive tract causing a leaky gut, these herbs help soothe that digestive lining and help us maintain that barrier between our immune system and our gut lumen that helps kind of decrease the inflammatory response in our gut. Sometimes that is a component of constipation that we'll want to address. Next, we have carminative. So this is when we want to avoid an atonic constipation. That's the one where we have kind of a laxity of the digestive tract. But it's really good for spastic constipation. So particularly if you're having pain with bowel movements, and then also a lot of gas and bloating from your intestines kind of moving things around too quickly, we'll want to bring in these carminative herbs, and that includes fennel, chamomile, and mint. And often we're combining the bitters and the carminatives for a complete formula to support our digestive tract in a couple of different ways. And then lastly, we have the cathartic laxatives. These are ones we only want to use with extreme caution. When someone's really constipated, we'll use them for a short period of time. But generally, we find that when people are coming in on laxatives, I'm often trying to get them off of them because you can become dependent on them to have a bowel movement. And things like senna can also actually change the sort of quality and nature of the inside of your digestive tract and can be problematic long term. So often I'm tapering people off of the laxatives and bringing on these more gentle strategies as we address the underlying cause of the constipation.
All right, physical medicine. We're going to talk about a few different types of physical medicine. First being visceral manipulation. Visceral manipulation was first developed by an osteopathic physician named John Burrell. And he discovered that all of our internal visceral organs, and visceral just meaning the internal organs, those the organs that you can't live without, they all have their own unique motion. So they have an intrinsic mobility and motility. So they both move in coordination with each other, and they also move within themselves. So when we're thinking about like the stomach at the first start of digestion, when you don't have food in your stomach, it kind of lies like this in a horizontal or transverse position. And then as you eat food, it comes down through the esophagus and it causes weight, and your stomach moves down. So this is this normal motility in the organ, in the stomach organ. And then it has attachments with fascia at the top part and at the bottom part. And it's attaching to different internal organs like your intestines and your liver. And so we find with visceral manipulation, if there's issues with the intrinsic mobility or the motion within the other organs and the interplay of that, if you ever had abdominal surgery and there's adhesions, things like that can happen. We are just doing very gentle hands-on therapy to try to get those organs in the fascia to either relax or just to go back into their inherent movement. So we are just encouraging that normal movement of each organ. So it's kind of assessing each organ. We're looking at the liver, we're looking at the stomach, the small intestines, the large intestines, that lower part of the large intestines called the sigmoid colon. It's often kind of gets attached and painful with people that have constipation. So just gently going in there and moving it to just bring the natural movement can kind of, like Dr. Schroeder was mentioning, bring back this coordination between all of the organ systems and allow you to have a easier bowel movement. And acupuncture, very near and dear to our heart. I love acupuncture for all sorts of digestive issues. Acupuncture is really the study of qi and blood in Chinese medicine. There is a lot that goes into like a different Chinese medicine diagnosis that we're not going to really get into, but it's really about regulating the qi of what we call our middle jiao, and that's just our center, our core, where all those visceral organs are. And it helps to move the qi. The qi is like the life force and the movement. If something happens in that middle jiao and the qi becomes stagnant, or if it starts to what we call rebel, which means go the wrong way, there can be some issues, and we try to encourage the natural movement of qi with acupuncture and using acupuncture needles to do that. We can also use electroacupuncture, which is just the addition of little electrodes that attach to our acupuncture needles, and they use different frequencies that will be introduced to your body system, and they can do cause release of different neurotransmitters. And at certain frequencies, the electroacupuncture can actually mimic peristalsis. And there's been a lot of really interesting studies on electroacupuncture and gastroparesis. And gastroparesis just means like slow movement. The peristalsis starting at the stomach is slow. And so there's studies showing that using acupuncture on certain acupuncture points, and not even abdominal points. There's some points on our legs. It's called stomach 36. It's right below, about 3 fingers below your kneecap. And doing electroacupuncture there can actually improve gastroparesis on par with some of the medications that we use for gastroparesis. So it's really, it really works. And acupuncture is one of those things, sometimes it doesn't work, but if it works pretty well.
Okay, so next we're going to discuss pelvic floor therapy. So before, when I was describing the pelvic floor muscles and how they're involved in constipation, this muscle group to the right is what I was referring to. So here we have, just to orient you, here's the pubic symphysis. So we're kind of looking up at the pelvic floor, kind of if you're like looking up into the pelvic bones. So this is kind of from the bottom up. And here we're looking at the pubic symphysis. And then, let's see, here we have levator ani to the right. This is this whole muscle group here. And that can get, tight from long-term contraction. It can be tight from some kind of trauma, whether that's, a historical trauma or any trauma during childbirth. You can get scar tissue in that area. And when we're too chronically engaged and we have a hard time relaxing, it can be hard to enable a bowel movement and to enable that coordination of the abdominal muscles coordinating and the puborectalis and levator ani relaxing at the same time as your sphincter opens. So this is kind of an underappreciated cause of constipation. But it's one of those things where if someone's had lifelong constipation and no one's ever addressed their pelvic floor before, it's something to consider, and it can be really impactful in terms of promoting healthy bowel movements. So sometimes, sometimes we'll have this sort of paradoxical movement with, or paradoxical contraction, where when we go to have a bowel movement, it will actually contract instead of relax. So that's another thing we can address with this therapy. And then lastly, one of the things that can happen is the rectum. So there's a wall between the vagina and the rectum, which is the end of our large intestine. And that wall can thin, and And when that wall thins, sometimes the rectum can sort of outpouch into the vagina, and that can just kind of cause a bulging sensation, and it can be harder to initiate a bowel movement if your rectum doesn't have enough kind of force to expulse the fecal matter. And so it's another cause of constipation that we can address with pelvic floor therapy. So pelvic floor therapy is a set of tools in which we use internal, so that's intravaginal and intraanal, and external body work to enable that pelvic floor to relax. We can also do at-home exercises to help engage the pelvic floor if there's too much laxity, or relax the pelvic floor again. And we also will bring in diaphragmatic breathing and abdominal strengthening as well, because your abdominal core and your pelvic floor core muscles are all interconnected and need to kind of work in concert with one another. So this is a great therapy that I am now offering at ARIA, and been really enjoying doing this work with people. All right, so another thing that we can consider is mind-body medicine. So there are lots of apps out there now that you can access on your iPhone or whatever phone, smartphone you have. And one of the more common ones is called the Nirvana app. This allows you to do self-guided hypnotherapy sessions, and this is really helpful for IBS symptoms. So there's a connection between our gut and brain called the gut-brain axis, and this is really important for coordinating the digestive system. And this kind of meditation and hypnotherapy can really help coordinate those two areas of our body that are sort of intimately connected, but to kind of heal that connection. Another thing you can consider is biofeedback. So there are tools that we have that can actually be inserted into your rectum, and it can allow you to feel the sensation of a full rectum when you've kind of lost that ability to sense it. That can be involved in that outlet dysfunction, constipation, where you're just not properly initiating a bowel movement. And this sensor is really amazing because it can kind of, it's like a balloon that expands in your rectum and helps you feel that sensation and can help you develop that gut-brain connection again when you've lost it over a long period of time. So that's another great tool that you can ask about for long-term chronic constipation.
Okay, so supplements. There's tons and tons of supplements out there on the market, so it's kind of hard to wade through what is good and what's not good for constipation. We'll just go in a little bit about some of the most common ones. Magnesium. Either people come in on magnesium or they've never heard of magnesium. So it can be used in a variety of types of constipation. It can be used in that spasmodic or painful constipation at low doses. This is what we call subcathartic doses. Catharsis just means like a large outpouring of stool. So if you use magnesium at a high dose, it will cause kind of watery diarrhea. So we don't want to do that, especially when people have a really painful constipation where their muscles already kind of cramping and causing pain. So we use magnesium at lower doses that aren't going to affect the stool consistency. And this just helps to relax that enteric nervous system, to calm down those muscles that are kind of spasming and causing pain and causing the incoordination of a bowel movement. And then we can also use magnesium on the other side. If someone has that atonic constipation, their muscles aren't pushing on the stool to come out, we kind of and their stool tends to be hard, not very hydrated, what we can do is use magnesium as an osmotic laxative. So osmotic laxative meaning that it draws water in. So when we take magnesium, water follows salts. Magnesium is a type of salt, and so it will draw water into your colon and kind of loosen up the bowel movement to have the stool to have a bowel movement. So there's multiple forms of magnesium. Some of the most common ones are magnesium glycinate, and this tends to be more relaxing. It's a magnesium that is combined with glycine, which is an amino acid that is kind of calming to our nervous system. So it can help calm down that enteric nervous system as well as our nervous system in general. And then there's magnesium oxide. The magnesium oxide tends to be more osmotic, pulling just more water into the colon. And there's lots of other forms. There's magnesium citrate that also tends to be more osmotic as well. And then there's probiotics. And so probiotics work on a few different levels that we briefly talked about when we were talking about the microbiome. The bacteria help to produce those short chain fatty acids, which help with increasing that peristalsis, which is that wave of movement to have a bowel movement. The most common strains in probiotics are Lactobacillus and Bifidobacterium species. And both of these bacteria produce lactic acid, which increases the acidity inside of your intestines, which helps to increase peristalsis, that coordinated muscle movement, and decrease transit time, which is all just technical speak to have a more coordinated and quicker bowel movement. So less time between each bowel movement. And there's been studies on certain strains of those lactobacillus, like Lactobacillus reuteri and Bifidobacterium, that are best for constipation. So when you're looking for a probiotic to try, looking for one that has both Lactobacillus and the Bifidio species, you kind of want a good combination of different species in there. So just finding one that has at least 5 to 10 strains in the probiotic. And then we're looking at the number of colony forming units. So that's the CFUs when you look at a probiotic bottle. And you're looking to get at least 5 to 10 billion. We usually even use them at higher doses if we're doing specific treatments. For like repopulating the GI system, there's a dose dependent reaction to probiotics. So the whole probiotics get complicated very quickly, but those are just some tips that you want to look for, is a good variety in the species and types of bacteria in there, and at a moderate high dose. Sometimes if you're taking too high of a dose, so if you're getting up there into that 50 and 100 billion CFUs in a probiotic, it can cause constipation. So that's just something to note. And then there's what we call prokinetics. And these are things that are gonna promote the gastrointestinal motility, that's increasing peristalsis or that wave. And these are things like prokine or motility activator. And these things just contain some of the herbs that we already were talking about, like motility activator contains a combination of artichoke and ginger. And so it's working as a bitter and increasing the peristalsis, but it's also interacting with the neurotransmitters to increase the peristalsis. And then there's 5-HTP, which is a precursor for serotonin, and serotonin increases that peristalsis time. And so we often give people just 5-HTP as a prokinetic, and it works pretty well. You do need to be cautious if you are using drugs that can increase serotonin, because there's a risk of something called serotonin syndrome. So these are things like antidepressants, so any SSRIs, NRIs, things like that. We just need to tell your doctor if you are on those things, because we generally want to avoid using 5-HTP under those circumstances. Okay, and finally, the pharmaceuticals. So it kind of how supplements work. There's different forms of pharmaceuticals and what they do to cause a bowel movement. There's four of the top common pharmaceuticals. Number one being bulk forming laxatives. This is just having that fiber-like effect. This is just things that you normally stir in water, and they're usually formed from methyl cellulose, polycarbonyl, or wheat dextrin. You do want to note too that if you have food sensitivities or if you have celiac disease, you want to avoid wheat. Wheat can often cause worsening of constipation. And this is also just being dosed in the gram dosings, but it can cause a lot of gas, bloating, and if you have any sort of stool impaction, it can worsen that. And just to note on this, if you ever do use the bulk forming laxatives, or if you're in the same thing when you're increasing your fiber through diet and nutrition as well, is really making sure you're drinking enough water and having adequate hydration. And this is because fiber is absorbing water, right? So if you're already a little bit dehydrated and you increase that total fiber intake, fiber is going to absorb all that water, just like, you know, the flax seeds or the chia seeds would if you mixed it in a cup. It's going to draw water into your intestines and it can dry out the stool even more. So if we're increasing fiber, whether it's the synthetic fibers in these bulk forming laxatives or through the diet without increasing hydration, it can kind of create a brick in your gut, and that's not the goal when you already have constipation. Then there's stool softeners, and this is thing like DocuSate. And what this does, it causes, it's a surfactant. So it's kind of like soap. It's going to loosen the tension on the surface of feces. So it's going to allow more water to penetrate into the stool. So if you have really hard stools, this kind of allows more water and fats, the lipids, to enter into the stool, to soften it up a little bit. It can also cause some cramping and diarrhea. The big one to note on DocuSate is that it can cause what we call a contact dermatitis, and that's a rash from being touched by something that your body is sensitive to. So your whole digestive tract is what I like to call your inside skin. So if you're sensitive to DocuSate and you take it either orally or as a suppository, wherever that is touching, it can cause a rash, right? So you can put it in your mouth and swallow it down, and it would cause a sore throat because you're getting a rash on the back of your throat and into your esophagus. And this can happen in your entire GI tract. And often we just don't see DocuSate working that often for constipation. It does work to soften the stools, but if you're having atonic constipation and the muscle issue, it's just going to soften stool and not actually promote a bowel movement. Okay, then there's the bowel stimulants, and this is kind of like the magnesium that I was talking about before. This is going to change the transport of electrolytes across your intestine, and we call this the intestinal mucosa, and that's just that layer of cells on your intestines, and it's causing more electrolytes to come into what we call the lumen or the tube part of the intestines. And then, like I was talking about before, anytime you have electrolytes or salts, these ions, the water is going to follow that. So it's leading to more water to be brought into the colon. It's also going to irritate the nerves that are surrounding, that are innervating the muscle around there. And then it stimulates the bowel to have a bowel movement. And these stimulants can cause large bowel movements that can cause some spasmodic pain. So this is often what Dr. Schroeder was talking about, like people that are on these cathartic laxatives that are bowel stimulants that have the same, like pharmacokinetics is what we talk about of how it works. It can lead to cramping, pain, and it's generally why we try to avoid them. So like Senna is available over the counter, like at a pharmacy. We also use it in tinctures and teas like that. And these things can also lead to electrolyte imbalances, leading to lower potassium and salt, which can kind of change how your muscles and your heart and different organ systems work and cause some issues with that. So we just need to be really aware that if you do use these bowel stimulants, that you're being, prudent to see if you're having any other symptoms that go along with it. Then the osmotic agents like we were talking about. So this is Miralax, and it's high dose magnesium salts. It's also lactulose, which is a sugar, and it helps bring in, like we were talking about, the water to the stool. And you want to be really careful if you have any sort of kidney or heart disease, because it can change the electrolytes. It can also cause really watery and urgent diarrhea. Okay, I think that about covers it. Thanks for joining us today. If you have any questions, feel free to send us an email or give us a phone call. I hope this was informative.
All right. And I just want to invite you all to our next Doc Talk. Next month, we're going to be discussing post-COVID syndrome and getting into specific issues we've seen most often with our patients after COVID. Should be a really interesting one and very relevant to everyone out there right now. So we hope to see you there. And thanks again for joining us. And thank you, Dr. Stocker.
Yeah, thank you.